If you have had recent surgery, you may have one or more incisions depending on the type of surgery you have had. After some surgeries, blood and normal body fluids may collect in the surgical site, which is also called the wound. Fluids can build up at the site and slow the healing process. They may also interfere with your daily activities and cause discomfort. To avoid fluid buildup, your surgeon may have inserted a flexible tube into the surgical site during your surgery. The drain allows fluid from the surgical site to drain into a reservoir that can be emptied. In this video, you will learn the steps to care for your drain, as well as the dressing covering the area where the drain enters your skin. Your wound drainage system consists of tubing, also called a catheter or drain, and a reservoir at the bottom of the tube, also called a bulb. Throughout this video, the wound catheter is referred to as the drain, and the reservoir as the bulb. The drain tubing is placed inside the wound by your surgeon and is secured to the skin outside of the wound with a suture or stitch. This area, where the drain enters and is stitched to your skin, is called the drain insertion site. The bulb provides gentle suction, which helps draw fluid from the wound site. 2 times a day, empty each bulb. Measure the amount of fluid in each bulb separately and record the amounts on a specific chart. The amount you record on the chart will determine when it's safe for your surgeon to remove the drain. There is a risk of infection at the incision site and at the drain insertion site. To avoid infection and help the healing process, it is important for you and your caregiver to know the right method for cleaning and caring for your incision and drain. This portion of the video shows you how to take care of your drain insertion site and the specific dressing your surgeon has chosen for you. You need to be aware of potential problems at the drain site and of any signs of infection. It is important that you call the breast center if you notice any problems. Before you are discharged, you are given a handout reviewing these instructions. It has care instructions specific to your drains and surgical incisions. The handout has phone numbers for you to call if you have concerns. Your incision may be closed with stitches that dissolve on their own or stitches that need to be removed by your surgeon at a later time. You may also have a dressing over your drain insertion site. There are many types of dressings used to cover incisions. The type of dressing you have on your incision may be different from what is shown in this video. You will receive separate written instructions on how to care for your incision and dressing. It is normal to have a little bit of swelling around each stitch along your incision. It is also normal to have a little bit of swelling around each drain insertion site. This mild swelling may last for a few days after surgery. It is also normal to have some oozing of clear yellowish fluid with a small amount of blood from the incision and around the drain insertion site. You may feel some tenderness in these areas. The fluid in the bulb right after surgery is red. This is normal because the fluid contains some blood cells. It becomes less red over time. It usually becomes a clear yellow or cloudy fluid with occasional small red blood clots or pink fibrous tissue. This is a normal part of the healing process. Call the breast center right away if the fluid in your bulb becomes bright red with clots or milky white in color. Also, call the breast center right away if you measure more than 250 milliliters of fluid within a 24-hour period. If your incisions or drains require dressings, you will be given the supplies you need to take care of them. You may not require dressings. If you run out of supplies, you can buy more, such as gauze pads, at any drugstore. We recommend a caregiver, who can be a family member or a friend, care for the incision and drain sites. Do not take a bath or submerge your incisions or any part of the drain system in water. Avoid swimming pools, jacuzzis, lakes, and oceans. You may take baths and swim only after your surgeon tells you it's safe to do so. You may shower with the drain in place 48 hours after surgery. If you are unable to shower, clean the drain insertion site with soap and water at least one time each day. You and your caregiver should always wash your hands first. Begin by inspecting the incision and drain insertion sites. Do this at least one time each day. Make a note of any changes in color or swelling at the incision or drain insertion sites. There are many ways to dress and care for the drain insertion site. There are also different types of dressings. Depending on what your surgeon has chosen for your specific needs, care of the area will vary. Please follow the instructions specific to your type of dressing. Tegaderm is a clear, thin, waterproof bandage that is applied over the drain insertion site at the time of your surgery. You may shower 48 hours after surgery. You may shower with the Tegaderm in place. Allow soapy water to run over the dressing like a waterfall. Rinse well. Pat the area dry with a clean towel. Allow to air dry for a few minutes. Remember, if you are unable to shower, clean the area at least one time each day. Without removing the Tegaderm, gently wash the area with soap and water and rinse well. The same Tegaderm dressing stays in place over your drain insertion site until you return to see your surgeon for a follow-up. Each day, while cleaning your incisions and drain insertion site, look for signs of infection. Typical signs of infection include redness or swelling, drainage with pus, opening of the incision, bad odor, pain and/or fever with a temperature above 101.5 degrees Fahrenheit. If you have any of these signs of infection, call the breast center immediately. Because you have a drain, you need to empty and measure the contents of the bulb. This is called stripping the drain. You must strip the drain at least 2 times a day to prevent the drain from becoming clogged with blood clots or fibrous material. To strip the drain, first wash your hands. With your non-dominant hand, firmly hold the drain without moving it near the skin at the drain insertion site. With your dominant hand, and close to the drain stitch, place an alcohol prep pad around the drain. With your thumb and first finger, gently pinch the drain with the alcohol prep pad and slide the alcohol prep pad down the entire length of the drain until your fingers meet the top of the bulb. The alcohol prep pad helps your fingers slide more easily along the tube. The fluid should move along with your fingers down the length of the drain and empty into the bulb. Repeat this procedure for each drain you have. It is not necessary to completely clear all the fluid from the drain, but try to move as many clots down the drain into the bulb as you can. If the flow of the drainage is blocked and stripping does not restore the flow, call the breast center. At least 2 times a day after you have stripped the drain, empty the fluid collected in each bulb into a separate measuring cup. To empty the bulb and measure the fluid, follow these steps. After stripping the drain, unplug the stopper from the emptying port located at the top of the bulb. Tip the bulb upside down over the measuring cup. Gently squeeze all of the fluid from the bulb into the measuring cup. Your nurse will give you measuring cups. If your bulb is small and fills quickly, you may need to empty the bulb and measure the fluid more than 2 times a day. Do not let the bulb completely fill, because this will stop the fluid from flowing into the bulb. Do not disconnect the drain tubing from the bulb at any time. If the drainage into the bulb stops, call the breast center. Two times a day, measure and record the amount of fluid collected in each bulb. It is very important that you record the amount of fluid for each bulb separately at least 2 times every day. Do not record a daily or weekly total. Do not record the total of all bulbs. On the volume of drainage chart, record the date, time, and amount of fluid collected from each bulb. Your nurse reviews your volume of drainage chart. This information is used to determine if your drains can safely be removed. After you have recorded the amount of fluid from each bulb on your volume of drainage chart, discard the fluid by flushing it down the toilet. In the evening, when you empty and measure your fluid drainage, take your body temperature and record it on the volume of drainage chart. If your body temperature is ever 101.5 degrees Fahrenheit or higher, call the breast center. After emptying and measuring the fluid from each bulb, you will need to reactivate the bulb suction. First, wipe the port opening with an alcohol swab to clean it. Next, gently squeeze the bulb and flatten it as completely as possible. While the bulb is completely flattened, insert the stopper into the emptying port as far as possible. Release your grip from the bulb. If the bulb stays flattened, you have successfully reactivated the bulb suction. In the next few hours, you will notice the bulb expanding gradually as it fills with fluid. If the bulb does not expand gradually and collect fluid, call the breast center. Gravity is necessary to keep the drains functioning properly. You must place the bulb below the drain insertion site. Using the plastic tag on the bulb, attach it to your clothing or drain belt. Do not disconnect, bend, compress, or puncture the drain tubing. If the drain becomes disconnected or damaged, contact the breast center. The length of time that your drain remains in place depends on the amount of fluid coming from the surgical site. When one drain produces less than 30 milliliters of drainage over a 24-hour period for 2 days in a row, your drain is ready to be removed. When your drain output meets this criteria, call the breast center and the nurses will schedule your appointment for your drain to be removed. The drains are usually removed within 3 weeks of the surgery, regardless of the drainage output. However, your surgeon may recommend removal at a different time. After your drain is removed, continue to wash that area of your skin daily with soap and water. After the drain is removed in clinic, your nurse may tape a 4x4 gauze bandage over the drain site. You may remove the tape and gauze 24 hours after the drain is removed. It is not necessary to replace the gauze. You are responsible for the care of your incision and drain insertion site when you leave the hospital after surgery. It is important that you recognize any unusual changes with your incision, the drain, and the drain insertion site. Call the breast center if any of the following things occur. The bulb suction cannot be activated. The drain falls out or is accidentally cut. The drain fluid in the bulb has a foul smell. You have a body temperature of 101.5 degrees Fahrenheit or higher. There is increased redness, swelling, or abnormal drainage from the drain insertion site. There is an air leak, fluid leak, or any other malfunction in the system. Clots form in the tubing and block drainage. The bulb is not collecting fluid. If you measure more than 250 milliliters of drainage from one bulb in 24 hours. If the amount of drainage is less than 30 milliliters in a 24-hour period for 2 days in a row. If the drain is no longer secured to your skin with a stitch. Before you leave the hospital, you will be given all of the supplies and information to properly care for your incision, drain, and drain insertion site. It is very important that you carefully follow these instructions. You may find it helpful to write down your questions and concerns. Do not hesitate to call the breast center to speak with a nurse for help if you experience any of the problems mentioned in this video. If you are ever in doubt, please call the breast center. We are happy to help you.